Well, good morning, everyone. I am Senator Ana Caballero, and I proudly represent the 12th Senate District. Before we begin, I want to welcome our special invited guests. I'd like to welcome Dr. Peter Breton, Jr., who is the president of the California Medical Association, Alyssa Jimenez, who is the Director of Health for Monterey County and the California First Five Commissioner. I'd like to welcome Dr. Shannon Kozlovich, who is the program manager for Equality California, Kate Wilbur, who is a youth advocate, and Hector Flores, who also is a youth activist. Welcome and thank you very much for joining me here today to discuss a terrible epidemic that has been plaguing our youth and our communities for several years, and if left unchecked, will continue to do harm for many generations to come. And that is the use of electronic cigarettes, also known as e-cigarettes, and vaping products. These products contain a harmful combination of nicotine, flavoring, and other chemical additives. This combination of nicotine and youth-appealing flavors, such as gummy bears, cotton candy, and root beer, along with heavy marketing, has made vaping a popular trend with children and teens. So why is this so important? Tobacco used in the product is addictive and has many really negative health side effects. It can cause nervousness, anxiety, the inability to focus or to pay attention, negative effects on mental health. It affects child brain development and can have long-term damage to health among many other health issues. Vaping has become increasingly popular despite the high risk of bad health impacts. According to the CDC's National Youth Tobacco Survey, nearly 20% of high school students reported current e-cigarette use, and about 40% reported heavy use of e-cigarettes. And as I indicated in the list of side effects, this can be extremely detrimental to students who are expected to study every day, to go to school, and to listen and be able to pay attention. Not only that, but tobacco retailers are more prevalent in the poorest and most ethnically dense neighborhoods, which includes population most at risk of inadequate healthcare access and coverage. That is why I have introduced Senate Bill 395, which is the subject of this press conference, which proposes to close the tax gap between cigarette products and e-cigarette products, to bring closer tax parity between the sale of vaping and traditional tobacco products. Proceeds of the revenue generated from this tax currently go to existing voter-approved sources, which are early childhood services, public health and healthcare workforce programs, and funding for physician student loan repayment programs. And so SB 395 will mirror the tobacco tax distribution so that we have the same sources of revenue for all of these voter-approved initiative, so that we're getting tax parity, we're getting tax money from these e-cigarettes and vaping products, and basically we can use it for good health prevention programs that we know do really good things for our community. With that, I'd like to introduce our first speaker, Dr. Peter Breton, who is, as I said, the president of the California Medical Association. Welcome, and thank you for being here today, Doctor. Doctor, you need to unmute yourself.
Sorry. Thank you, Senator. for having me join this conference to help support your life-saving bill. As said, I'm Dr. Peter Breton. I'm a transplant urologic surgeon, and I'm the president of the California Medical Association products and other tobacco products. We know that vaping products are more likely to be used by teens and young people than other forms of tobacco. Nevertheless, they still can cause taxation is the most effective way to reduce the use of tobacco products, particularly among teens and other young users. By bringing the taxes on vaping products in line with those in other tobacco products, we will reduce the usage of these addictive products and protect the next generation of would-be tobacco users. This is a common sense bill that's supported by the California Medical Association and all our partners who are focused on protecting public health and protecting kids from the predatory tactics and harmful products of the tobacco companies. As president of the California Medical Association and on behalf of our more than 50,000 members, I would like to thank Senator Caballero for leadership on this most important issue and urge the legislature to send this bill to Governor Newsom for a signature. Again, thank you for the opportunity to support this most important life-saving bill.
Thank you so much, Doctor. Appreciate you being here today and your participation. Next, I'd like to turn the mic over to Alyssa Jimenez, who is a Monterey County Director of Health Services and also a commissioner with First Five.
Good morning. Buenos dias. As Senator Caballero said, my name is Elsa Mendoza Jimenez, and I'm the Director of the Health Department in Monterey County and a recently appointed First Five California Commissioner. I'm very pleased to be here today to discuss Senate Bill 395 and want to thank Senator Caballero for her leadership on this very important issue. Like others who have spoken, First Five is deeply concerned about the increase of youth vaping habits across our state and supports this legislation in its efforts to help curb consumption of these dangerous products. Despite the high risk of negative health outcomes, the prevalence of vaping among youth and other vulnerable populations is alarming and is something I see in my county every day. In 2019, 1 in 4 high school students and 1 in 10 middle school students reported using e-cigarettes the previous month, reflecting a frightening uptake in youth vaping habits. Additionally, 80% of parents who vape do so in homes and in cars, exposing thousands of young children to toxins such as heavy metals, ultrafine particulates, and nicotine through secondhand exposure. Not to mention that tobacco retailers are more prevalent in lower income and minority communities who often lack healthcare access and safety net services, as mentioned by Senator Caballero. In spite of these alarming numbers, our state taxation policy has not kept up with public health concerns around vaping. In fact, taxation rates on other tobacco products, which includes vape, have declined by over 8% since 2017. This means that vaping products cost less to consumers today than they did 4 years ago, making them more accessible to the general public. Simply put, California is not meeting the public health concerns around vaping. This legislation will fund a number of primary prevention programs that can get at the heart of tobacco prevention by helping address social determinants of health. Funding dedicated to early childhood systems through First Five will help ensure the longevity of prevention programs and systems that have supported our youngest children in California to thrive for decades and that have proven their essential nature during COVID-19, including childcare, health and developmental screenings, and voluntary home visiting programs. Policies like SB 395 will help strengthen communities, bolster the social safety net, and support an increasing number of young children, families, and individuals throughout California who rely on these critical public services. Our state will feel the effects of this pandemic for years to come. Now is the time to shore up our programs, services, and systems that serve young children and their families and invest in our shared future. This legislation will help us get there. I strongly and respectfully urge lawmakers to prioritize this very important bill. Thank you for the opportunity to speak today.
Thank you so much for joining us. I appreciate your comments. Next, I'd like to introduce Dr. Shannon Kozlovich, who is the program manager at Equality California. Thank you for joining us here today.
Yes, thank you so much, Senator Caballero. As the senator said, I am Dr. Shannon Kozlovich. I use she, her, hers pronouns, and that is doctor as in scientist. I am a program manager at Equality California, which is the nation's largest state-based LGBTQ+ civil rights organization. We want to thank Senator Caballero for introducing Senate Bill 395, also known as the HOPE Act. This act will add an additional tobacco retail tax onto electronic cigarettes, more commonly known as vape products. Tobacco use is the leading cause of preventable premature death among lesbian, gay, bisexual, transgender, queer, or the LGBTQ+ people. It's also the leading cause of preventable premature death for all adults in the United States and around the world. Vaping is tobacco use. LGBTQ+ adults are 2 to 3 times as likely to use tobacco products as their cisgendered straight peers. The 2020 California Student Tobacco Use Survey showed that high school students still use these tobacco products, vape products specifically, in a year when many schools were closed and access to these products was difficult. And our state's LGBTQ+ high school students still used vape products at higher rates than their peers, particularly our gender nonconforming or non-binary students. These data show that even our LGBTQ+ young people use vape products at 1.5 to 3 times the rate of their peers. And in California's Central Valley, tobacco use rates are higher than other areas in the state. And we're home to many communities with lower tobacco cessation rates. Low quit rates and high use rates mean that we need to focus on tobacco use prevention to stop people from picking up this habit. We need to make it more difficult for our upcoming generations to become addicted to nicotine. After all, the tobacco executives themselves told us that tobacco products are nothing more than nicotine delivery devices. We have seen through the life of Prop 56 and Prop 99 funding that we can put tobacco retail taxes to work against the tobacco-related health disparities that we see within the LGBTQ+ community and all the diverse communities to which we belong. Additionally, we have seen that increasing the cost of tobacco products acts as another layer of product use prevention and decreases daily use among those who are current tobacco product users. Increasing tobacco product costs can include things like minimum price policies or ending the redemption of tobacco product coupons, or through increases or addition of tobacco retail taxes as proposed in Senate Bill 395. This bill will provide revenue to support vital public health programs and initiatives to combat the tobacco use epidemic, while at the same time reducing the number of new tobacco users who enter the market each year. Equality California is thrilled to be here, is thrilled to support Senate Bill 395, and urges the legislature to pass this piece of legislation. Thank you so much, Senator, for having us here today.
Thank you so much for your advocacy and for all of your hard work. It's really pretty unbelievable that that the use of vaping products and tobacco, which causes so many opportunities to damage the lungs, was being used during the time that we were in a worldwide pandemic, asking people to be safe and to do things that were better for their health, and yet people continue to use these kinds of products. So thank you very much for your advocacy and for being here today. Next, I'd like to introduce Kate Wilbur, who is a youth advocate and knows a whole heck of a lot about vaping products. Kate.
Thank you, Senator, and for the opportunity to be here. For several years now, I've worked with the San Benito Youth Association and local leaders to pass legislation and educate my community about the dangers of underage tobacco usage. Seeing discarded Juul pods on the sidewalks and my fellow students vaping in school bathrooms was just a really distressing wake-up call to just how serious this problem was in my community. But underage tobacco usage and vaping is not just an issue in San Benito County. It is an epidemic that is disproportionately affecting youth across the country. It's the latest evolution of tobacco and the cigarette, which unfortunately has captured a very young and impressionable audience. Youth users are far more likely to become lifelong tobacco users with more severe addictions, according to the American Lung Association. This is incredibly dangerous as big tobacco seeks to hook these audience with vape products at an earlier age. Youth are being preyed upon and targeted through ads, fruity e-cigarette flavors, and targeted marketing. According to the CDC, dollars spent on tobacco marketing targeted at youth directly correlates to increased usage in the past 5 years. The youth vaping epidemic has also skyrocketed amidst the pandemic. High levels of depression, anxiety, and the lack of support and isolation has caused youth to turn to vaping for a sense of relief. The proposed vaping tax would be incredibly important and a step forward in combating this major problem. With online retailers, vape products are ridiculously easy to purchase and access. The added cost would help discourage younger users and make tobacco products less accessible. The state must take steps to immediately protect the vulnerable youth from lifetimes of suffering and addiction, starting with SB 395. I hope you'll join me in our fight for youth and their futures with your support for this bill. And thank you again for the opportunity to be here.
Thank you. And thank you for your advocacy. It's important work. And to have a young person out talking about why this is important is really important in the community. Next, I'd like to introduce Hector Flores, who is also a youth activist. Welcome.
Thank you for having me. So good morning, everyone. My name is Hector Flores Garcia. I am a health advocate intern for Future Leaders of America. As a health advocate, I promote health equity for low-income youth and communities. Our work is centered around creating a smoke-free environment in the respective cities of Carpinteria and Port Hueneme. We are actively fighting and advocating for the health of our communities by collecting signatures to stop flavored tobacco from targeting our youth and secondhand smoke in multi-unit housing. Recently, we have been launching a social media campaign around secondhand smoke and smoke-free policies. The CDC reports that 8 in 10 multi-unit housing residents choose to make their homes smoke-free, showing favorability in creating smoke-free environments. In the coming weeks, we will participate in tobacco trainings to collect local data on smoking. We will analyze this data to help create infographics that bring attention to the health disparities in low-income communities. In addition, this information will be presented to local city council officials to demonstrate the community support for a healthier environment. Youth are the most vulnerable to the predatory practice of the tobacco industry. Among students who reported they were currently using a tobacco product, 73% of high school students and 57% of middle school students reported using flavored products. Vaping has become increasingly popular among our youth because they are not aware of the harmful chemicals that are in these products. Many teenagers continue abusing flavored tobacco products despite the risk of adverse health outcomes. As a community, we need to find solutions that tackle this youth vaping epidemic. We believe everyone should have an equal chance at living a healthy and prosperous life. We would like to see our local efforts matched by our representatives at the state level. Thank you all for your time.
Thank you. Appreciate all your hard work, and that data is going to be really important as we try to figure out how we get the message out. There's a belief that these vape products are not harmful, and that we need to dispel that. So all the work that you're doing is going to be really important. I have to apologize because there are 2 additional individuals that have joined us here today, and I wanted to make sure to recognize them and to thank them very much for participating. Dr. Eric Chung, who is a Merced County area dentist. Thank you, Dr. Chung, for joining us here today. Really appreciate it very, very much. And if you'd like to say a few words, I'd like to give you the opportunity to join in if you'd like. Thank you. Appreciate it. And also, I'd like to introduce Margot Grant Gould, who is the Policy Director of First 5 California. Likewise, I'd like to offer you an opportunity if you'd like to say a couple of words. And thank you for joining us here today. Thank you. So let me just say that that this bill is currently in the Assembly, and it passed the Senate with bipartisan support and no opposition. So we're currently in a policy committee in the Assembly, and any support to Assembly legislators appreciated. It's important that they understand the importance of this bill and the importance and the challenge of having a bill with no opposition. We've worked very hard to bring everybody together to make sure that that everybody feels comfortable, and that includes the vaping industry as well. And so it is important for us to make sure that the Assembly understands the need for the bill, the opportunity to fund preventative health care policies and programs, and the need to get it done this year in particular, so that we can really have an impact on the use and abuse of nicotine products in California. So I want to thank you for joining me here today. Thank you for your support of SB 395, and thank you for your advocacy on behalf of good health in our community. Appreciate it. Thank you so much. If there are any questions from the press in the future, I'd be more than happy to answer. So thank you all for joining me.